www.healthcmi.com, acupuncture news, research, and continuing education. Hello, I'm Adam White, licensed acupuncturist. Today, we'll cover an article entitled Acupuncture Relieves Failed Back Surgery Pain. This appeared as an article in the healthcmi.com news site section, which is located at the top of every page at healthcmi.com. Notice there's a news link. Go to it and look for Acupuncture Relieves Failed Back Surgery Pain. You can search for it too. Published October 12th, 2015. This article outlines research showing that after a back surgery where there is residual intractable pain, that acupuncture can relieve that pain. So, the surgery may have fixed a physical problem or anomaly, yet there is residual pain after the surgery. So the patient is dissatisfied or suffering. However, the surgery may have already fixed the issue. That does not necessarily mean that the pain will be resolved. So, acupuncture can then relieve the pain by calming nerve inflammation. So that's the thrust of this article. And the research is very detailed. So it gives 2 specific acupuncture protocols for licensed acupuncturists to go ahead and get rid of residual pain after back surgery. Now, using this type of procedure can prevent the need for multiple surgeries in an attempt to correct the original surgery, whether it had caused the pain or failed to simply correct the pain from the original problem. So one of the acupuncture point prescriptions outlined in this article from the research had a 94.87% total effective rate, and another approach had a 76.32% total effective rate. Great approaches to care. Naturally, there are many approaches to relieving residual pain after surgery with acupuncture. Now, failed back surgery syndrome is discussed by many doctors. For example, this article cites Slipman and others from the Penn Spine Center at the University of Pennsylvania in Philadelphia, and they say that, quote, failed back surgery syndrome is a syndrome consisting of a myriad of surgical and non-surgical etiologies. Approximately 1/2 of failed back surgery syndrome patients have a surgical etiology, unquote. And Chanadal from Mount Sinai Hospital in Toronto, Canada, note, quote, failed back surgery syndrome is a challenging clinical entity with significant impact on the individual and society, unquote. And finally, one can find on the Cedars-Sinai website, quote, after any spine surgery, a percentage of patients may still experience pain. This is called failed back or failed fusion syndrome, which is characterized by intractable pain and an inability to return to normal activities. Surgery may be able to fix the condition but not eliminate the pain, unquote. Now that's where this article comes in, because acupuncture can correct the pain. And that's very important because patients are seeking answers. They get the surgery and now they have intractable pain. They're running out of answers. People don't necessarily want to be on very strong pain medications. They want full range of motion and abilities, and they want to live without pain. And this article shows the research on specific procedures on how to get patients out of that pain, which is why it's important. I'm Adam White, licensed acupuncturist for healthcmi.com news, research, and continuing education. Thank you for listening.